Thank you for coming to tonight's talk. My name is Scott Hoffman, and I'm the principal of the Bromfield School, the host school here. And the topic tonight is vaping and marijuana and its use and the issues around that. And I can tell you as a principal, I'm in 3 different principals groups, and the topic of vaping and marijuana comes up each and every time. What are you doing? What are you doing? How many suspensions have you done? Have you searched these kids? But part of the issue is that we need to make sure that we're educating parents, students, community members about the dangers of these things, and making sure that although marijuana has been legalized, that we really need to understand the ramifications of an adolescent using marijuana, vaping, and all of these things. How important is this? Anybody that knows me knows that I go to all student events. And they also know that as a former coach, in particular basketball and also soccer, they know that tonight there is a state semifinal soccer game after winning the district title that just kicked off. It's important enough tonight that I'm here, that I'm not at that game. And anybody, and the kids ask, "You're not going, Mr. Hoffman? You're not going?" I said, "No, I need to be here tonight because this topic is that important." All right, it is one of the issues facing educators in our community at this time. Before I turn it over to our guest speaker, I'd like to thank the PTO for their generosity for sponsoring this night. I'd also like to thank Tyler Hill in the back for once again getting the whole thing ready for us, whatever AV we need. Also Harvard Cable News for videotaping this, because I got a lot of soccer parents who were planning on being here tonight and obviously chose to go see their children play, and that's what I would expect as well. All right, and obviously I'd like to thank Colleen Nixis, who did all the legwork, our school nurse, to get everybody here. So I thank you for the community. Tonight's guest speaker on marijuana, vaping, and our youth, what you should know, is Dr. Kevin Hill. Dr. Hill is an addiction psychiatrist at Beth Israel Deaconess Medical Center and an assistant professor of psychiatry at Harvard Medical School. Dr. Hill's clinical research has focused on treatment and intervention to help those wanting to stop the use of marijuana. He has received multiple competitive awards as an investigator and published on numerous topics of addiction. In addition to clinical trials he directs, Dr. Hill sees patients in his private practice and consults to the Boston Red Sox, the NFL, and the NBA. Over the past 7 years, Dr. Hill has been asked to weigh in on marijuana policy issues such as medical marijuana and legalization of marijuana. He is committed to bridging the gap between the science of marijuana and the public perception about marijuana. And I can't think of a more important topic than that one right there. As a student, as a father of a student at UNH, it's incredible for me to walk on that campus and see what's going on and hear my daughter talk about what's going on. He has spoken nationally and internationally to students from public to private school, parents, healthcare professionals, and organizations about marijuana science, policy, and treatment, as well as alcohol and opioids. In 2015, he authored Marijuana, The Unbiased Truth About the World's Most Popular Weed. Because of his broad education, training, and experience on the field of psychiatry, and his unique ability to effectively communicate in common sense language, he is frequently called upon for his expert opinion in any number of news outlets. Without further ado, please welcome Dr. Kevin Hill.
Great.
Thank you so much.
Thanks. Thanks for having me. Tyler, can you guys hear me? Good. All right. So I appreciate the introduction. When I told my mother to write it, I asked her to keep it short. So unfortunately, it's a little bit longer than I wanted. But no, thanks for coming out. I really appreciate it. Obviously, you got a big soccer game, and I hope that goes well today. But we certainly have an important topic, and so we'll cover a lot of ground in a relatively short period of time. So I'll speak for about 45 minutes, then we'll take all the questions that you have. And so I'd begin by saying that, unfortunately, because of the way that things have played out in the state over the last handful of years, you've heard a lot of misinformation, unfortunately. And the people that you hear about marijuana from are people that have skin in the game. They're trying to get you to vote one way or another. A couple of years ago, people were trying to get you to vote for or against legalization. In your town recently, they may have tried to opt out of legalization and that sort of thing. So as a result of that, there's a lot of powerful people with money behind them who have spoken on this issue. And unfortunately, both sides, both people who are for it, people who are against it, are guilty at times of distorting the evidence. So my job, as it's been over the past several years, is just to present the evidence. A lot of the answers that we're finding for the questions related to marijuana aren't the ones that we're expecting. And so you have to be open-minded and be available to new evidence as it comes out. So my contact information is there. Feel free to think of me as a resource moving forward. In terms of disclosures, it's quite a large screen, but I've been funded by NIDA. I recently did some work with the World Health Organization related to medical cannabis, and the book's been out for a few years, so check that out. So again, to hear about where I come from, the sort of perspective that I have, I'm a clinician first and foremost, so I see patients every single day. So that's also something to remember. When you think about who you've heard about marijuana from, what do they do? Are they involved in the industry? Are they making money selling marijuana? Are they people who are lobbyists of some sort? I mean, unfortunately, a lot of people who are talking about it, they've never seen a patient. We're going to talk today about a subset of people. So again, to be clear, a subset of people who use cannabis in a problematic way. And if somebody hasn't seen that before, if you're not used to seeing that, if you've never known somebody that's had that kind of problem, if you've never treated a patient who's had that type of problem, I think it's hard to understand that type of perspective. Because as we'll see, there are plenty of people out who are, these days who are using marijuana and they're not having a problem, right? Just like alcohol. So those people, for whatever reason are able to do this in moderation. Unfortunately, there are a lot of people who aren't able to do that. And that's really what we're going to be talking about today. Try to be clear about what the evidence is, and then also, if there is a problem, what to do about it. And it's sort of a special added feature, we're going to cover vaping today, because I know that's been an issue here and all around the state, really, particularly at the high school level. So we'll take a few minutes and talk about really where the evidence stands with that, because that's something that's rapidly changing, and we're learning more and more. There's actually a big development today with vaping, so we'll talk about that. So again, I treat patients. I run a consultation service at Beth Israel, so we treat patients, a lot of patients who are suffering from opioid use disorder, so you're familiar with the opioid crisis, so we treat patients with opioid problems, alcohol problems. Cannabis obviously has been my specialty. If you're a sports fan, you know that drugs and sport go hand in hand, so I treat those players, the Red Sox, players from the local football team, also the basketball team, and I help a couple of those leagues make their cannabis policy as well. Done research over the years, as you heard in the intro, trying to develop medications and behavioral interventions for people who do have problems with these substances. And then the final bullet here is what we're doing today, trying to bridge the gap between what the science says and what public perception is. And I think with marijuana in particular, there's a huge gulf because of the fact that in state after state, and I think Massachusetts is a great example. In 2012, we voted on medical marijuana. 2016, we voted on legalization. So we've had these type of battles going on for years here over this. You're constantly bombarded with people who are trying to spin the evidence. And as a result, most people, particularly young people, they don't really know where the evidence is. And as I'll show you tonight, I think that's a major issue in the sense that when you talk to young people about nicotine, for example, cigarettes in particular, there's a difference obviously between cigarettes and vaping, as we'll talk about today, and why vaping is a special challenge. But kids know that smoking's bad for you. Kids know that drinking is bad for you. It doesn't mean that people aren't going to do it to some degree, but the problem is if we were to fill this audience today with young people and were to ask them about the dangers of marijuana, you're going to hear a whole host of answers. And that's a key issue, right? We need to be clear about what risks are. As people decide to do things that may have risks involved, they need to know what those risks are. And I think that's a key problem. We can do a good job of educating kids as we have done before with these other substances, and we haven't done it yet with marijuana, as you'll see. So let's talk about the numbers with marijuana. So again, you've heard so much about it over the years, but the numbers are huge. So these are huge numbers. We've got 22 million Americans using cannabis in the last year. That represents a doubling or so over the past decade or so. And then again, like in Massachusetts, when you have people voting, as we've had all over the country, voting on medical marijuana, voting on legalization, you have these very powerful messages because people are trying to sway your vote one way or another. In addition, there are other people that have powerful platforms as well. So I'm grateful for you to come out on a really cold night. There's other things to do. But as much as it's great that we've got a decent crowd here tonight, if Justin Bieber or somebody like that decides to talk about weed tonight, he's going to reach a lot more people than I'm going to. So that's what we're talking about when I mentioned that, a second ago that we're trying to bridge this gap between what science actually says and what public perception is. So this slide here is important too because I think it really does two things. Number one, it helps you think about the real addictive potential of cannabis compared to other substances. And then it also helps you begin to think about how I think it's useful to frame this if you are going to talk to your kids, let's say, or young people. So again, as I mentioned earlier, most people who use marijuana don't have problems, right? Most people are able to do this in moderation, but the people who develop an addiction, or what we would call a cannabis use disorder of adults, that's about 9% of users. With young people, the numbers are higher. So it's about 1 in 6, or 16, 17%. The challenge is, though, unfortunately, is that if I have 6 15-year-old kids who are using marijuana, while only one of them will go on to develop a cannabis addiction, I can't tell you which one it's going to be. So that is why one of the key messages that we'll have here tonight, that if you're worried about your son or your daughter and what they're doing, then you owe it to them, you owe it to yourself to really investigate, to have an evaluation done, to try to figure out really what's going on. Hopefully nothing that requires any intervention. But I will say this, having done this for a number of years now and seeing really thousands of patients at this point, that if you are concerned about it, more than likely there is something that requires intervention. So that may not be a cannabis use disorder, it may not be a cannabis addiction, but it's probably something. Could be depression, could be anxiety, ADHD, could be a psychosocial issue that's driving these problems. So again, if it's raising to the level where you're concerned, it's probably justified. So when you compare cannabis to these other substances, on the whole, it is less addictive if you look at these percentages. So 9% of adults here, as you see, alcohol 15%, heroin's all the way on the right. So that's at 23% in this study. But again, 23 to probably a third or so. And we also keep in mind, if we're going to talk about opioids, people really aren't using heroin anymore. The patients that we see every day are using fentanyl, which is far, far more potent. So that's a topic for another day. But I do think it's important because when you think about these substances and you're talking about this and you're teaching about it or you're trying to have conversations about it because you're concerned about one thing or another, you have to be evidence-based and you have to be sensible about it. So marijuana has its own, as we'll see today, has its own risks, but it's not fentanyl. Okay? So I think that's one of the problems that people who mean well, they don't want their kids using, they don't want their students in their school using. But if you come at this with such a hard-line stance and you're making it seem as though if they use, they're doomed, you have a difficulty there and you may lose your credibility. So I think it is important to point out there are different degrees of danger as I think about it, right? So if you've got 9% of adults developing a cannabis addiction, you've got 15% of people using alcohol develop an alcohol addiction or alcohol use disorder, let's call it a third of opioid users, those are really different degrees of danger in terms of addictive potential and in terms of what is the worst possible outcome that can occur. So again, I've seen people who have lost multi-million-dollar careers because they can't stop smoking marijuana. So that's pretty terrible. But it's different than the patients that we see, unfortunately, who do overdose on fentanyl and die, and relatively routinely. And there are multiple people in the Commonwealth every day who are overdosing, and many of those people are dead, unfortunately. If you have an opioid overdose and you require Narcan, a reversal agent, 10% of those folks are dead within 1 year. So it's a whole different thing. And I think that when you're concerned and you're trying to educate people about these things or talk about these things in a clinical sense, you have to be sensible in this way and balanced with the evidence. So just because marijuana may not be as dangerous as fentanyl is, doesn't mean that it's not dangerous, right? So there are different degrees of danger. You can take really any one of these substances and take that use into a very harmful, problematic sense. You can overdo any of these things. Really, I mean, it's a little bit more difficult, certainly with tobacco, but the point is that people make choices about what their drug of choice is. So you may have somebody who really likes alcohol, somebody might like cannabis, somebody might like stimulants, somebody might like opioids, and then they may take their use of that particular substance to a very harmful level, which could impact their work, their school, their relationships. So you can take substances which have different potencies, different levels of danger, but then turn that use into a very harmful thing itself. So this slide here is from Monitoring the Future, one of the major survey studies. There's a couple of major survey studies that come out every year. This one comes out of the University of Michigan. They monitor youth use, youth perception of harm. And I think as you'll see here, you have use and risk, side by side. So again, as much as you hear about these things, over the last several years, while people have debated medical marijuana, legalization of cannabis, etc., youth use has been relatively flat. So that has not really changed in the face of these policy changes. But what has been problematic is on the right side, perception of risk. So while these policies have gone into play, while time has gone on, for whatever reason, could be availability of cannabis, whatever it is, it's multifactorial. There are many things that play into it. But at the end of the day, young people in particular, so we're looking at, again, high schoolers here, their perception of cannabis has gone down over time. So that's really where the danger is. And as I alluded to before, to me that speaks to our inability to effectively educate young people about the dangers of cannabis, right? So if we were to plot perception of risk, as I mentioned earlier, nicotine, alcohol, it would be an entirely different story. So for those substances, for nicotine in particular, and again, vaping is kind of its own thing that we'll talk about later, but cigarette use is really at all-time lows among young people. And alcohol use actually has dramatically been reduced similarly over the last several years. So that perception of risk piece, I think, is the variable here that is not going in the way that it really should be as state after state is implementing these policies, right? If you have more and more states with legalization, more and more with medical cannabis. So we've got more than half of the country with medical, and again, increasing numbers of states that will have legalization. So this is ominous, in my view. Right? This is not the way that you want it to go as more and more people gain access to the drug. So this slide here, again, there are many things about this that are very confusing, things about cannabis that are not intuitive. And this speaks to, again, the controversies around cannabis. It's such a polarizing topic. And if you think back to the couple of votes that I mentioned, medical in 2012, legalization in 2016, right? You got a lot of people who are very strongly opinionated on one side or another. And I think I think we slipped ahead there. So I think in those cases, when people are trying to get you to vote one way or another, they tend to oversimplify these arguments. They're trying to paint things with a broad brush. And you can't do that here. There are many nuances to this. It's not as simple as we would like it to be. And then the second bullet here, people are misguided by their own experiences. As we'll see in a moment, the cannabis of today is very different than the cannabis of yesterday. If there are people out there that may have used years ago, they may think about this and say, well, we used when we were a teenager and we turned out okay. And that's understandable because that's your experience, but you have to understand that the potency is very different, as we'll see in a slide. Finally, the last bullet here is this idea that large numbers are very complex, right? I don't like large numbers, particularly late in the day. But when we think about marijuana, the numbers are huge. Like I said, 22 million Americans using. If only 9% of that 22 million develop a cannabis use disorder, right, a small fraction of this very large number can be a large number, and it is in this case. So let's talk about some of these myths. Let's talk about where the science is. I think these are really three key jumping off points that people like to talk about and often aren't quite clear on what the science is. So the three key myths that I like to talk about: not harmful, not addictive, and no withdrawal. And we'll also talk about how, again, some people who mean well have done a disservice in many ways by not really presenting the entire picture, which we're trying to do here. A special caveat, though, when you think about the harms of cannabis, young people are particularly vulnerable in this way. So your brain develops into your mid-20s, so about 25 or so. So for some of us, it's over. For the young people in the group, or those that will watch later, via tape, again, your brain is developing. It's under construction, as you'll see here. The choices that you make are critical. It's much as, when I have a couple of daughters, and, I'm trying to get them to eat healthy, drink your milk, etc., with the idea being that when you're growing, you have to fuel your body in the right way. So those choices are even more critical. And the same really holds true, the same notion holds true when you think about the substances that you may choose to use or not. So again, if you're doing things in a regular way, so we're talking about people who are using regularly, then you can have a host of consequences. And when you think about cannabis, that one jumped ahead on me. When you think about cannabis in the brain, cannabinoid receptors, so there are two main types of cannabinoid receptors, one of which is primarily located in the brain, and as a result, using cannabis either today or using it regularly can affect your brain in a whole variety of ways. Some of which you see here, right? So again, like the amygdala, let's say, that's the fear center. If you're using cannabis today, you're feeling the effects of cannabis, you may not have that fight or flight response that you might normally. Certainly your neocortex, in terms of your ability to think at a higher level, that's going to be affected today, certainly if you're using a lot of cannabis. If you use regularly, as we'll talk about in a minute, can also impact your ability to think. So cerebellum has more to do with balance and things of that sort. So as you may be aware, if you're using cannabis today, it can affect your ability to drive. So the effects are wide-ranging over the brain, largely because of the receptors that are located throughout the brain. But I think one thing that has not been talked about enough when you hear about the harms of cannabis is this idea of dose. So if you're going to do this, and you're going to do this completely in a scientific way, then you have to point out this concept of dose. How much over what period of time really makes a difference. So as we'll talk about right here, as you see here, there are all these problems associated with chronic cannabis use. But that's heavy use. That's people who are using, the patients that I see are using pretty much every day, multiple times a day, and they've done it for a period of time, an extensive period of time typically. What are the effects of sporadic use? People who use once a week, once a month? That is less defined. So I think that's critical to point out. And I think that when you think back to the debates that may have taken place in your town about legalization, for example, when people point out these problems, the folks who are very staunchly opposed to cannabis, they often won't fully disclose the idea about dose, right? That it really makes a difference. Somebody who uses 3 times a day, 7 days a week, that's different than somebody who uses once a week, once a month. So that's critical. And if you're going to do this, you should present all of the information. So these people, when you're talking about regular cannabis use, typically below 25, so in the developing brain, that can affect cognitive function. So there's one study, for example, let's talk about a couple. So if you look at imaging studies of the brain, compare young people who are using cannabis regularly versus those who are not, the young people who are using cannabis in a regular way are actually recruiting different parts of their brain to do the same amount of work. So when you think about that, to me, the analogy is if you're revving your engine, your car engine, at high RPMs today, it'll get you where you want to go a few miles away. But but it's probably not a good long-term strategy for success for the life of that engine. And that's been borne out in some other studies. So this Madeline Meyer paper in 2012, that's one that you know, if you've been paying attention to this, you may have heard of before. So they followed over 1,000 patients over time. They did neuropsychological testing at 2 points, and they found that those that started early and used regularly lost up to 8 points of their IQ over time, which is more than a standard deviation. So that's significant. So if you're a young person and you start using regularly at a young age, the impact is dramatic. Right? The other things here, so anxiety, a lot of people, so I mentioned earlier things about cannabis that are not intuitive. Anxiety is one of them. If you're anxious and you use cannabis, your anxiety will go down today. But when cannabis wears off, your anxiety goes back up. So people try to medicate that over time. As a result, using the whole plant cannabis to treat anxiety is not a good idea. It actually worsens your anxiety level. So again, to be thorough, there are certain components of the plant, certain cannabinoids that may ultimately prove to be successful to treat anxiety, but using the plant itself with high delta-9 tetrahydrocannabinol, THC, high THC cannabis to treat anxiety, not a good idea. Also worsening depression if you're spending most of your time using cannabis. And then finally, this last piece here, this psychosis piece, which I think is very scary. If you have a family history of a psychotic disorder, so that's schizophrenia, bipolar disorder with psychotic features, schizoaffective disorder. If you have a family history of one of those conditions and you're using cannabis regularly, you're more likely to express that. So that's not a causal relationship necessarily, but it's a very strong association. And so how that plays out clinically for us is that, you know, we may see a 17-year-old kid, never seen a psychiatrist before, now they're in a hospital, they're having hallucinations, and then the family is asking, you know, people like me, well, are they ever going to get back to their baseline level? The answer is probably not. So they're on, at that point, they're in a hospital, they're taking really serious medications, and then there's a battle to sort of get back to normal. And I follow, you know, some of those patients I followed over years, and you know, they may ultimately, you know, have a job and may be doing okay, but they're not meeting the potential that they could have by all accounts. You know, the patient themselves are frustrated by it. Family obviously wishes that it had been differently. So the choices that you make at a young age are critical here, and that's just why we want to have all the information out there. People are going to make the decisions that they make, but we want to inform those choices as best we can. This slide here I borrowed from local colleagues. So Randy Schuster's at MGH. This is a paper that came out really a couple of weeks ago, and I just wanted to share it just because, again, it's always great to share the latest and greatest. And there's a lot of interesting papers that come out in the city. But this paper was interesting because, it was looking at young people using cannabis. And I think the take-home point here is really on the left side here. What you see is measurements of memory here. And you've got, you know, as you see the red line here, it's such a large screen here, but the red line are those that are abstinent from cannabis, and then the control group here continue, the green line are people who continue to use cannabis. And as you can see here, what the message here is that if you are able to stop using cannabis within a week, so this red line shoots up, I don't know if I have this, yeah, so this red line here shoots up in 1 week of stopping cannabis, you see an improvement in your memory. So that's really hot off the presses, and it kind of underscores this idea that, again, the choices you make are very important when you're young, but even if you're using it in this way that's problematic and you stop, you know, there's still opportunity to gain back at least some of what you've lost. So it's never too late to do something about it. And as you can see here, you know, memory comes right back in a week or so. So this is a short-term study, but it's important. It just underscores this idea that you should intervene if you can and do whatever you can to try to have somebody stop. Attention really was not affected by abstinence, which is, you know, also important. But that study, I think I wanted to share just because it just came out. We're always trying to learn new things. The second myth that I want to talk about is this common idea. People talk about whether or not cannabis or marijuana is addictive. And so I say, however you want to define it, it absolutely is. So as much as we can talk about certain diagnostic manuals, et cetera, definitions of addiction, I like a simple definition: repeated use despite harm. So that's somebody who continues to use regularly despite problems in these other key areas, right? They're not doing their homework, they're not taking care of their responsibilities, they continue to use. And so this slide, I think, nicely shows some of those ideas. So you got the brain on the left side here. The pleasure center of the brain is the nucleus accumbens. So when you're doing things, when you're using substances or you're doing things that are pleasurable, reinforcing, you have releases of multiple chemicals. Dopamine is probably one that you may have heard of before. So that's what we're showing here, the release of dopamine in the nucleus accumbens. And as a result of that, we're comparing really three substances of sorts on the right side here. And so these graphs show releases of dopamine after using stimulants or amphetamine. Marijuana in the middle here. I'll go with cheesecake, I guess, here. But the point is this. So again, the scales are different. So this is measuring the release of dopamine in the brain. The scales are different, but the graphs are essentially the same shape. And so what my point is here is that however you want to define addiction, so most people, I don't think anybody's going to argue, cocaine, amphetamines, stimulants, those are addictive, right? We all agree to that. But when you think about the surges in dopamine caused by amphetamines or stimulants, cannabis does the same thing. So that gets back to one of the ideas that I mentioned at the top of the talk, that again, you may have different levels of danger or different substances that have their own levels of risk, but patients or people make choices, again, about what their drug of choice is. So if marijuana is your thing, you're really liking it, you're using it every day, and you could have a host of problems as a result. So I do like those types of comparisons. I think it's okay to talk about alcohol and cannabis and compare them in that way. They're similar in many ways. Some people are able to use without a problem. Some people do have a problem. What I don't like are really distinguishing between hard drugs and soft drugs. Because again, you can take a soft drug. I think most people, if you're going to split them up, you'd probably say marijuana is a soft drug. But yet, here it's doing the same thing that stimulants are doing. Clinically, we're seeing the same thing, right? People who are using every day, they're getting kicked out of school, they're losing their job, they're losing their relationship or their marriage. So you can have the same types of problems. By the time you get to me or somebody like me, it can be very difficult to tell who's got a problem with marijuana, who's got a problem with alcohol. So I think that's one of the take-home points here. You have a substance that may not be a problem for some people, but for other people who have a family history or have other impulsive behaviors for whatever reason, they may also have a psychiatric disorder like anxiety or depression or ADHD. Those people are more vulnerable, and so then they can develop an addiction to cannabis. Finally, the last piece here, this idea of withdrawal. So this is more of a clinical thing that helps us understand why it is that those people who have a problem with cannabis find it hard to stop, right? So this is a nice series of studies done by a couple of great researchers, and they compared cannabis withdrawal. So think about that. So if you're using cannabis every day, a lot, multiple times a day, and you try to stop abruptly, this slide shows that the symptoms that you have will be very similar to the symptoms that you have that if you were smoking a pack of cigarettes a day and you stop cold turkey, right? You're going to have anxiety, you're going to have irritability, you're going to have difficulty sleeping. That's the point here. So from a clinical perspective, somebody comes into me and they're smoking, half an ounce of cannabis a week. It's a pretty significant amount. If they're going to stop abruptly, then we need to prepare them for these symptoms. So you can do a couple of things. Number one, just by letting them know, yeah, you're probably going to feel pretty lousy. That puts them in a better position to be able to withstand it. Or you could do things to try to treat those symptoms. So you have some options. So again, there are treatment options here if somebody's using to this level. I mentioned this earlier, just talking a little bit about the substance, understanding it, again, why people are so interested in it. You've got a plant with hundreds of chemicals. Chemicals specific to the cannabis plant are cannabinoids. So there are over 120. I would say about 126 if you talk to some of my friends around the world who are chemists and do this. So think about that. You got a plant, hundreds of chemicals, you got 126 cannabinoids. We really only talk about 2. So delta-9 tetrahydrocannabinol, THC, that's what makes you high. On one side, it can also make you psychotic. On the other side, just to talk about a hot topic, cannabidiol, CBD, has been in the news a lot lately. So this is actually a better term, is really not psychoactive. It's better to say it's non-intoxicating. So it's not going to make you high. It will affect how you feel, but it's not going to make you high. It might have, as I said this earlier, it might have anti-anxiety properties and also possibly antipsychotic properties. The reason why you hear these two mentioned together is because cannabidiol functions as a buffer of sorts to THC. So again, a lot of people talk about CBD as sort of a panacea in many ways. It's not, but it does have a lot of promise, something that we really need to study more. I mentioned this earlier too, that the potency of cannabis has really skyrocketed recently. So if anybody out there or anybody in town may have used cannabis years ago in the 60s, 70s, or 80s, the average THC content then was probably 3 or 4%. The latest published data from Mahmoud El-Soli, who's in Mississippi, who I collaborate with, his paper in 2016 put the average THC content at about 13% or so. But those numbers have since increased. So average THC content, if you ask Dr. El-Soli now, is probably about 18, 19%. But we know that if you were to go out and buy it, you could get the plant in the 20s and 30s. So my point is this. So again, if you had your own experiences years ago, it's very, very different now. It's apples and oranges. So you have to really wonder about what the different implications may be with a much more potent cannabis. And then other forms, one of which we're going to talk about. So just to mention this, these are their own topics under their own. We've got synthetic cannabinoids on the top here, K2 spice, spike. So I mentioned THC and CBD buffering that THC. Synthetic cannabinoids, there's no buffer. So the worst that could happen with THC happens with synthetic cannabinoids. The only thing I'll say about that, if you have other questions, we could take those later. But people who use synthetics are people who are going to be drug tested. So people on probation, people in the military, athletes that we treat, etc. Those are people that use synthetics. So this concentrates, wax, shatter, dabbing. So those are really pure forms of cannabis, 80 to 90% THC. E-cigarettes, vaping, we're going to talk about in just a second, so just hold that thought. And then finally, edibles here, which are kind of the scourge of many states that have implemented these policies. To me, edibles should never be a problem just because it's really a question of educating people. So, I mentioned at the top, why is this so controversial? Why are there so many things about cannabis that people misunderstand? A lot of it is because we just don't take the time to educate people. When you think about it, if you have a THC brownie that has THC infused in it, average, the amount of THC in a brownie would be probably 100 milligrams of THC. The average serving size is 10 milligrams. So I don't know about you, but if I'm having a brownie, I'm eating the whole thing. And when that happens, if you're talking about 100 milligrams of THC, I'm going to be in the ER, right? I'm not going to die, but I'm going to be out of commission for a while. So that kind of thing happens very frequently still, and it really should never happen if we're doing a good job of educating people about these things. But let's move on and talk about vaping, because people wanted me to address this. So it's really a major issue in a lot of schools. The slide previously, the synthetics, edibles, etc., those are also problems in various pockets of the country over time. I've been all over talking about these things. But vaping's really been an issue, particularly at the high school level. Let's spend a couple minutes talking about it. So why is that? I think the first one is that people feel that vaping is less harmful than smoking cigarettes, right? And that could be true. We'll talk about what the data say about that. Certainly easier to conceal, so if you're in school and you're using something of this size, right, you can have it in your hoodie and doing that. So that's a major issue here. I'll show you another slide which sort of reinforces that in a second. The per use cost is less, right? You have to spend a little bit of money to get, a Juul or whatever, but ultimately it's cheaper than smoking cigarettes, $10 a pack, that kind of thing. And then finally, the flavoring, you can get, watermelon, creme brulee, all this stuff. And so, and again, talking about new information, the FDA is announcing restrictions next week that the manufacturer of the Juul that we'll see in a minute has taken the product away from retail outlets, so you'll have a more difficult time finding it. So what is the truth about it? I think that, again, while you probably are exposed to fewer carcinogens or fewer chemicals than in cigarettes, it's still bad for you, right? So if you had to take one or the other, it's probably not as bad as smoking cigarettes, but both of them are bad for your health, certainly, particularly at a young age. Nicotine, so you're getting nicotine through a cigarette, you're getting nicotine through an e-cigarette, or when you're vaping. Nicotine's highly addictive, right? It's a problematic chemical. You're going to increase heart rate, increase adrenaline. If you use chronically over time, you increase your rate of having a heart attack. So again, I'm not saying that everybody who uses is going to have a heart attack, but again, chronically, it's not a good thing to stress your system having increased heart rate, having increased levels of some of these chemicals. The long-term effects of vaping are really unknown. I think that's a major point here, is that at this point, with use skyrocketing over the past several years, we really don't have the long-term data to this point. So Tyler, do we need this light here? This one here? So again, the jury's still out with a lot of the data. In terms of a gateway, so like I said, when you look at some of the data, 2015 is from the Surgeon General. He estimated at that time the data came out, high school students increased by 900%, and then 40% of young e-cigarette users had never used. So people who had never used nicotine before are initiating that use with e-cigarettes, with the Juuls, we'll see. So however you want to look at it, if you want to compare one to the other, at minimum, this is a risk-taking behavior, something to be worried about, right? Are there other things going on, or are you using other things? On the whole, using, vaping by itself in a moderate way may not be an issue, but I would be concerned about it and think about what else is going on here. Another slide of why. Why is the Juul, which is in the middle, dominating this whole discussion? Well, look at this. I mean, these other, vaping devices, they look like mufflers and things like that. So somebody who developed this sort of looking like a USB stick has dominated the market. So that's what the Juul has done, and you can kind of see the appeal here, right? If you're thinking about something that doesn't look as ostentatious as other things, something that might be easier to put in your, conceal, well, now you know why this is stuck out and has really dominated the market. So that's the Juul. Looking at some of the data, so 80% of this young group who tried Juul continue to use it. So you think about why that is, it's because it has a significant concentration of nicotine. So the pod that you put into one of these devices is essentially equivalent to, on the whole, it's equivalent to a whole pack of cigarettes. And actually it's probably more than a pack of cigarettes, because when you're accessing nicotine through a regular cigarette, you're filtering some amount of that. And you're not doing that with a vaping device like the Juul. So very highly potent. So you're taking a substance that people aren't familiar with, and they're initiating use of nicotine, which is problematic. We've had, if we were talking, certain groups, again, working with baseball players who dip, it's a similar thing. You're taking a lot of nicotine and you're using it, and some fraction of those people are going to continue to use it in a problematic way. Just so happens with Juul, it's a pretty high number, people who continue to use. Certainly not all of them are meeting criteria for a nicotine addiction, but when you have the majority of people who try it continue to use it, then they stay at risk. So vaping is really an issue. And just, again, hot off the presses, today the company announced that they would withdraw the product from retail outlets, but they only did that because the FDA is coming down with a hammer next week on them, and so they just proactively did it. I mean, they didn't see that they had a choice. So it will be harder to get this, but people are resourceful. I imagine they're going to continue to do that. I mean, it's certainly going to hurt their sales to some degree, but it's something that we really need to keep an eye on here. So just to be aware of that. So to shift gears again, thinking about treatment. So we talked about marijuana. What are the risks there? What does the data say? We talked a little bit about vaping, certainly. But when you think about any of these substances, could be somebody who's drinking, could be people who are using, obviously there's 2% of high school students may use prescription opioids, so that sort of thing. But any type of problematic, people could use benzodiazepines, Xanax, Ativan, etc. But any kind of problematic substance use, what do you do about it? If you think that's going on, if you find that it's going on, what do you do about it? That's what we're going to talk about over the next few minutes. So what to do about it. And just a typical case here, because I think this is more illustrative of the types of things that we deal with. So if I can read it. Kristen, 15-year-old high school student, comes to see a clinician after getting suspended for selling marijuana at school. Previous had treatment for anxiety. This patient also was cutting herself, and she said to me that she'd rather be messed up, and that wasn't the verb that she used, by the way. But I think this case is a very typical case, right? It shows a lot of things. Number one, with marijuana, things usually need to rise to a very high level before anything is done about it, right? It's hard for people who are busy, who are working, you might have other kids. It's hard to recognize when these types of things are going on beneath you, and we'll talk about what to look for and why that is, but I think this is a typical case, right? If somebody's selling marijuana, chances are they've been using for a while and they're supporting their habit to some degree, they're financing it, they've got a network of people. So she got caught selling it, and she was obviously using very heavily at this point. Also, when you see treatment for other things, it shows a very important point that if somebody's using it in a problematic way, that usually does not occur in a vacuum. There are other things going on, right? She may have an anxiety disorder. There could be other issues going on at school. So you have to be aware that it's not just this one addiction issue going on. And then finally, the kind of foreshadowing a bit about what treatment might look like. If people are wanting to be high every day, then you have to explore why that is. What is it about themselves or their lives at this point that makes it so that they'd rather be in an altered state? So that kind of is what you ultimately have to figure out if you're going to try to help somebody stop doing this or cut their use way back if you can. So we'll go back to that case in a minute, but thinking about the types of things that you need to be looking for to figure this out, I think ultimately you have to know what is normal to figure out what's not normal. So to know what a baseline level is. Things that may occur, you could have social problems caused by these substances, so they may have a problem with the police. Kids in a car with cannabis is kind of a typical thing that I may see. People giving up important activities. So, and again, big soccer game tonight, but you could have somebody, a young person who has played town soccer for 10 years, and they may get to their sophomore year, and they may not be playing soccer this year. So that doesn't mean they have a problem with marijuana necessarily, but it might, right? So that's the typical thing. They've been doing this for years. They liked playing before. Now they're not. What's going on? It may just be they're moving on to something else, but there could be a problem there. Use in dangerous situations can occur, obviously, again, getting back to use in cars and things of that. And then this here is really the most common referral that I get from other clinicians, other doctors. So that's a kid who may have depression, put on a medication, the medicine's not working, or somebody has ADHD and they've tried Adderall and Ritalin and those things aren't working, and now after a period of time, people have figured out, well, this young person is using cannabis 3 times a day. So that's something that, there are other problems that have been identified, but, the treatment's not working in part because of the level of drug use that's going on. So what do you do about this? I think about this really in 4 ways. So this is really for the parents, the teachers who are going to try to approach young people who have these sort of problems. I think about this in this sort of 4-step process: preparation, conversation, evaluation, and referral. We'll talk about each one of these. So preparation, to me, and we have this, building a bridge here, is this idea that you have to build it before you need it. And so I have one of my patients that I followed now for a long time. He told me in the early going, he said, look, my father talks to me about 2 things: the Red Sox and the weather. And that's really the opposite of what we're talking about here. You have to be willing to get in there and talk about these uncomfortable subjects, at least ask about it, right? Because if you're willing to do that, you may not have them answer you like on your time frame. You might not get the answers you want, but by expressing that interest in these areas, if something bad is happening later, or if they're concerned about it later, you increase the likelihood that they're going to come to you. It says, I think, my parents think that this is important, or the teacher thinks this is important, or the coach, or whatever, and so that increases the odds of you being able to talk about them later, or talk about this issue later. Have an idea about what you would do, right? If you're concerned about somebody and you want them to, as we'll see in a second, see somebody about this, and they say yes, where are you going to go? The window of opportunity may not be open for long, so you have to be able to capitalize this. If they don't want to do it, then what are you going to do as well, right? So young people tend to be stubborn at times, so I've heard this story over and over again. We were concerned, we wanted him to see somebody, but he just wouldn't do it. And a lot of times when parents are met with that level of resistance, they just kind of give up, right? I don't know what to do. He won't go in, he won't come and see somebody about this. And unfortunately, a lot of times, people don't end up getting the treatment they need because they're, putting up that level of resistance. So you have to have an idea about what you're going to do either way. In terms of that conversation, I like to make it pretty simple. I think about saying, look, I'm concerned about you. I think you need an evaluation. So you're not making a diagnosis. You're not passing a judgment. Ultimately, I think if you're trying to move somebody, if you're a parent or a coach and you're trying to move somebody along to have them be ready to get help, then I like to think about these kind of tangible things, right? So I'll let you in on a secret. I've never had anybody call me up and say, hey, doc, I learned I can lose up to 8 points of my IQ if I don't stop smoking marijuana, right? That's never happened. But what people are concerned about is, look, I want to go to Dartmouth, or I want to play in the sectionals in 3 weeks, or I want to continue to drive my car. So those are the things that I think about, but they're also the things that you should think about too, if you are trying to get somebody to motivate into doing some kind of work, some kind of treatment, to get some help. You have to think about what's at stake that they may value, that they may be concerned about losing. What does that evaluation look like? So from your perspective, you don't have to really know what the answers are. You just have to know where to get them. So never worry alone. And it doesn't need to be a psychiatrist, could be a psychologist, could be a social worker, just somebody that is experienced in this area so that you take advantage of that opportunity, because that window, like I said, might not be open for very long. So you got to be able to do that. You ultimately do need a thorough evaluation, and we can talk about what that is in just a second. From my perspective, like I mentioned earlier, the tangible piece, my main job, if I'm working with a young person and they're using cannabis every day and their parents are concerned, is to figure out what that thing that they're worried about losing is. So if I've done that, then I can build the rest of it, right? So I'm doing that, trying to figure out what is important to them, which may be different than what their parents are concerned about or what I might be concerned about. Taking that careful history, because like I mentioned, these things don't occur all by themselves. There's often other things going on. This is really the biggest piece in that initial evaluation, building that alliance. So this day and age, when you think about it, with technology, right, if you are walking around, everybody's in their phones doing this sort of thing. If you're sitting with somebody and you're asking them questions, you're expressing interest in how they're doing, I think it can set yourself apart pretty easily, right? It's something different. So you're expressing that you're caring about what's happening to somebody. So if you do that, and by the questions that you ask, if you are having them understand that you know a few things about this, you increase the chances that they're going to ultimately get the help they need. Probably not right away. So if somebody is very resistant, they need to be pushed in, they may not want to do the things that are necessary right away. But if you have taken the time and you built that alliance and you figured out what they may be worried about losing, then they may ultimately come around and get the treatment that they need. This piece about recommendations, so if I'm seeing a young person, I want to have their parents come in too, so that we're all on the same page about what I think needs to happen. Like I said, a lot of times these things aren't done right away in terms of the treatment, so we want everybody to know what might be necessary. And then also this idea that it's a fluid picture, right? Something that may not be necessary today might be necessary in a week, or vice versa. So this kind of picture is often in flux. And then finally, a referral. So when you're talking about, let's talk about cannabis, residential treatment is probably not what we're talking about here. If things are really bad, we're probably talking about some type of outpatient program where they're going to be at home, going somewhere. Could be a few times a week, could be every day for a couple of weeks. But the bulk of the work for somebody that has a cannabis or a marijuana addiction is going to be an outpatient thing, maybe just talking to somebody once a week. I mean, it varies. So that's really treatment. You're not going to do a detox, right? You're not going to do detox for cannabis. You're not going to go away to a program. We're just trying to get somebody in to talk to somebody who knows what they're doing, and then building that alliance like I mentioned before. So back to the case. So Kristen started weekly talk therapy and then had a limited period of absence. So I think that's worth pointing out. So if I have somebody come in, they're using 3 times a day, 6 days a week, 7 days a week, it's hard to just totally shut that off, right? So they may not be able to do that right away. One thing that people are often concerned about, if they've been using a substance like marijuana for years, they're worried about, well, I don't know if I could never do this again for the rest of my life. Well, I try to take that off the table. I try to say, look, if there's depression going on that you may be concerned about, there's some other problem that you are concerned about, can we get a limited period of abstinence? Let's get a month and see if your mood is better at that point. So you have to start with very manageable increments and try to work your way from there. So that's what she was able to do. Address coping mechanisms. Again, why do you prefer to be messed up rather than being your normal self? Difficulty in giving up an activity that she'd come to enjoy, and then she did well. So this actually, I have a bunch of patients like this, but people can do well. Things may be bad. You might get suspended. You might have some problems, with the law. But if you get the right treatment, and at some point they become willing to get that help, they become motivated to do the work, people can do well. So to sum it up, and then we'll take some questions. I think, as I've said at the top, you've got a lot of misinformation out there. People are trying to get you to think one way or another. They're often not being balanced. They're spinning evidence. The reality is we're learning more and more about this, and sometimes the answers aren't what we're expecting. So you have to be open-minded and be willing to evaluate the evidence as it comes in. From a treatment perspective, it's really hard to predict who's going to do well. So things may seem like they're hopeless, and people may turn it around and do very, very well if they get the right help and they're motivated. So, that's really a major take-home point. You shouldn't worry about it. Your community is interested, obviously, for setting up an event like this. There are people out who want to help you and put you in touch with people who can sort of move that further along. So with that, just thank Matt Palastro, who's a former research assistant of mine who now is in medical school, helped with the early versions of this talk. And I'll take some questions. Thanks.
If there are questions for Dr. Hill, I have the microphone right here.
Some people swear to me that cannabis oil cures everything from cancer to hemorrhoids. Is there any truth at all to the curing ability of cannabis oil, and what is cannabis oil? Thank you.
No, it's a great question. So when people talk about the cannabis oil, most of the time they're talking about cannabidiol, CBD. So that's, we talked about this a little earlier. It's really hot right now. And I will say that there is a strong preliminary evidence for the use of cannabidiol or that cannabis oil for a whole host of medical conditions. But the level of that evidence is really strong for only a few things. So seizure disorders, for example, there was a version of cannabidiol that was FDA approved recently for some seizure disorders in young people. The short story is, I think that people are kind of rushing ahead of the science in some ways with the oils. And you can get it online, you can get it in dispensaries. It's hard to know exactly what you're getting. And also caution you, people are selling a lot. You mentioned the oil, so that's something that you would ingest. But there are people also selling a lot of CBD creams that are not absorbed into the bloodstream. So I'd be cautious at this point for things that you're buying online. It's kind of like any nutraceutical that you'd get. So I'd say overall, it's exciting, but I think that probably people are a little too excited about it in the sense, probably putting the cart ahead of the horse. Yep. I can repeat the question too, so go ahead. Yep.
My understanding is there's more brain damage and whatnot that occurs. I'm not sure, but the other thing is, what are the studies about gateway drugs regarding
Yep.
nicotine and marijuana?
Yeah, sure. Great. So two questions. So synthetic cannabinoids, the K2, spice, etc. Brain damage may not be the right term, but on the whole, the worst things that you can have occur when you use cannabis resulting from the THC. So that's really psychosis. And you're more likely to have psychosis occur, hallucinations, bizarre behavior when you're using synthetic cannabinoids because what you have is a THC-like compound. So it's not THC, but it's similar, and you don't have CBD. So you don't have a buffer for that substance. And so that's why, again, if you're a sports fan, you know that some athletes have used synthetics and done some pretty crazy things, and so it's very dangerous. On the whole, synthetic cannabis is more dangerous than regular cannabis. The second question, the gateway question, comes up all the time. I actually addressed this earlier today in a different venue, talking about the gateway. So Americans, when we talk about gateway, we're talking about a causal relationship. So we're talking about if you use something at 14, you will definitely go on and do these other things. And if you think about cannabis in that way, or that's your definition of gateway, it's not a gateway drug, right? If you use at a young age, it's a risky behavior. You're increasing the likelihood that you will go on to do other things, to be addicted to cannabis or addicted to opioids or other things, but it's not automatic. So at what we see clinically, if you're 13, 14, 15 and you're engaging in those behaviors, you may be using cannabis or alcohol or nicotine. So in that sense, if you're talking about increasing risk, then they're all increasing risk. But I think that we try to, oversimplify things as Americans. And so people talk about if you do this, then you definitely will go on to do these other things. And it doesn't work that way. There are plenty of young people that use cannabis at a young age and don't go on to do these things, right? Like as we mentioned at the top, if you got 6 young people that are using cannabis, only one of them will develop an addiction to it. But we should still be concerned. Who else? Yep.
Could you just explain dabbing and concentration?
Sure. Yep. So dabbing, we had a slide not going to go all the way back, but dabbing, when you talk about dabbing, you're talking about concentrated THC. So if anybody out there is good at chemistry, I wasn't very good at chemistry, but what you're doing is you're distilling the plant down into a very pure form. So you're taking, again, let's say you buy 20% weed, cannabis, plant the flower, 20%, and then you distill it down into a very pure form. So now you've got a liquid that is, a gelatinous form that is 80-90% THC. How do you use that? Well, that's really where the dabbing comes in. So you can take, a fleck or a small piece of that. Usually it hardens. You might take a piece of that and use an apparatus or a rig to sort of heat it and vaporize it, smoke it. So that's really what's going on with dabbing. But anytime you're taking concentrated THC, you increase addictive potential, you increase the chances that you're going to have psychosis, etc. So we're very concerned. And what we see a lot of people who are using cannabis regularly, and they like the fact that the potency's gone up, but if you can get 80 to 90% THC, then that's tempting for them. And so we've seen a lot of patients who transition to really full-time dabbing. I mean, it's a minority, but they do that, and those are people that it becomes even more difficult to try to help them because they're using such high potency products. Yes. Yeah. Yep. So yeah. So when you're using, so it kind of gets back to a couple of. So talking about dabbing, wax, shatter, etc., and the dangers of those products, particularly for people who are less experienced, it gets back to the concept of dose, right? So as we talked about, how much over what period of time? So if I eat the whole Kit Kat, it's got 100 milligrams, I'm going to have a problem. If you take 80% THC and you use that and you're not an experienced user, you're going to have a problem. Certainly people who are using every day, it may not be a big deal. So there are many variables here, and it's important to kind of keep them all in mind. Yep. Yeah, it's a excellent question. So the answers are really twofold. The first one is, so my research has been over the years, you mentioned Suboxone, so medications that have proven to help people not use illicit opioids. Somebody's using fentanyl, they come in, we put them on buprenorphine or Suboxone, they continue to work, they're doing well, that sort of thing. There's no equivalent drug for people who are addicted to cannabis. And I've done a bunch of studies using a whole bunch of cannabinoids, and there's no FDA-approved medicines there. I mean, there's some things that are in the works. So the answer is we really don't have that drug. Talking about abstinence, that's really sort of an interesting question about what your goals are for treatment. For me, if a patient comes in, I'm usually, as I mentioned in the case, I'm usually trying to get them to establish a limited period of abstinence. So we're talking about trying to become abstinent for some period of time. However, I've treated enough patients to know that if you got somebody who's using cannabis 20 plus times a week, and you're able to get them down to 3 times a week, to me that can be a clinically significant reduction. So my treatment goals, I mean, I'm usually shooting for abstinence, but I'm comfortable with less than that. I'm going to take it. If I can help somebody keep their job and they're still smoking a couple times in the weekend, I'm going to live with that. And that's just the reality. There are also people who, you're able to help them become completely abstinent for some period of time, and then later on they may go back to using to some degree, and that might make you uneasy, but it's not to the same degree that it was before, and you got to live with that too. So there's all variations with different substances, but that's kind of how that works. You're trying to help them stop. Yep. Yeah. So if you talk to patients when they talk about using cannabis, they'll say, yeah, I tried it with friends, and I used to use it once a week or whatever it was, once a month, and for whatever reason, I think those early experiences are usually quite pleasurable, like they enjoy it, makes them feel good. They might have a family history, so that increases vulnerability. But, you know, when I talk to patients, you know, it usually is a matter of months. You know, if you're going to choose that as your thing, maybe something is going on, you know, you got relationship problems, or you're worried about the end of high school and where you're going to go. I mean, those things often contribute to it becoming a daily thing. So yes, you're not going to jump right into using every day. You're not going to jump right into dabbing, but it is a progression. Yep. Nope. So it's completely up to the employer. So, you know, I work, in addition to the athletes that, you know, I work with pilots, for example, and your employer can decide, I mean, they can determine whether or not it's a safety sensitive position or not. I mean, it's up to them. And that may ultimately change to some degree, but, you know, I know there was one case, like a food service worker at a hospital has recently sued, and, you know, I'm not optimistic. I mean, really, it's challenging. And more places of employment are talking about more frequent drug testing, right? And so it's a whole other issue, but the short answer is it's totally up to the employer right now.
So in a related question, THC driving or
It depends on the time frame. So usually, you know, the impact upon driving would be within 16 hours or so, but you're still, if you test, if you do a qualitative yes or no test, you're going to test positive. So, you know, if you have that employment drug test and you're positive, yeah, you might not be under the influence, but you're positive. So it's you know, the whole science of driving and things, I mean, it's a major issue. It's one of the things that I've said that we really should have done a better job of ironing out before you legalize in these ways. And so it's another way in which the policy is ahead of the science, unfortunately. Yep, in the back. Yeah. Yeah, you bet. Just by having the conversation. I mean, you know, a lot of us don't want to have uncomfortable conversations, and so we avoid it. And so I think that there are many places where what you're kind of describing, I'm thinking, are kind of sensible conversations, right? These are the risks. This is what, you know, I did when I was your age, et cetera, like being open, transparent about these types of, this is what I'm concerned about for you. So those are conversations that you can have, like it or not. You know, you're a role model, and your child, you know, when they're out on Friday or whatever, they're going to remember what you did or what your sense of it is. It may not always lead them to make certain choices, but it's going to be a factor. So those conversations that you have, the types of education that takes place in schools is critical. So, you know, again, there have been a lot of, you know, in the past, schools using these sort of scare tactics that have been proven not to work. So I think sensible conversations about them, which do two things, right? Number one, relay some of the information that we talked about, but probably more importantly, just says, hey, I think this is important. I'm willing to ask you about it and talk about it so that if at any point down the road you got a question, you're going to come back and we're going to talk about it. It's fair game in that way. So that's where I would begin. Yep. Good question. Great question. So the question is, vaping, is it only nicotine? No, it's not. But the bulk of the vaping that is done in the schools and is nicotine. The reality is, you know, if you had one of those, like the first e-cigarette device, the bulky things that I showed, you can put anything in there. So you can put, you know, the flower cannabis in there if you want to. You can also put the wax or the hardened concentrates in there. But, you know, I'd say, I mean, I'm not, you know, haven't looked at data recently, but the overwhelming majority of vaping that goes on is nicotine these days. Anybody else? Yep, in the corner. Yeah, I mean, I think there is. I mean, I do want to point out, though, that we're talking about different risk levels for 25 and below and then everybody else. You know, so really, there is moderation that can occur. Like I said, the reality is there are a lot of people who are doing that, who treat cannabis like they would alcohol. So, I think that's fair. I think the major difference, right, as much as I invite those type of comparisons between alcohol and cannabis, I think the major difference between the two is that, one, alcohol, everyone here knows the risks. Cannabis, hopefully we're closer to knowing the risks after this talk, but people aren't uniformly in agreement about what the risks are there. That has to improve. But I think the answer to your question is yes. There are people who are using and they're not having a problem, and that's great. But there are also this subset of people who have a really serious problem with it, and those are the people that I see. Oh, safety for adults? So I think it's tricky. So one of the issues with talking about safe use for adults in cannabis is that we all know, if you drink alcohol, you have a sense for how many drinks it takes for you to feel the effects of alcohol, right? And so with cannabis, unless you're a really experienced user, there really isn't that window, right? If you use cannabis, unless you're a significant user, you're going to feel that right away. So, there's not that two-drink, some people can have a couple of drinks and really not be impaired. There's less of that availability with cannabis. And sort of makes it a little bit trickier. Anybody else?
Related question, depends on the risk. Alcohol, ethanol, right? Cannabis, two major components, 120 others. How can you know what the long term?
We don't. Yeah, so the question is, how do we know the long-term effects of cannabis? We really don't to a large degree. There are some larger studies, that have been funded that are ongoing now, so we'll learn more. But I think one of my major messages has been, if we have 30-plus states with medical, we got, double digits now with legal, we should be having more research done, and it shouldn't just be the federal government funding it, right? We should have states like Massachusetts who are profiting fund some of it. We should have companies, right? There's many, many companies now that are making a lot of money on this, and they're not really contributing to the science base. So I think that has to change. And in Canada, obviously legalized cannabis, and they're probably doing a better job than we are at doing these types of things, at advancing the science. And so, I think that we should be doing a lot better than we are in that area. Yeah, so none of the substances, cannabis, alcohol, nicotine, none of them are going to cause any of these psychiatric disorders. They can worsen existing conditions. And so in that way, alcohol certainly can worsen. I have plenty of patients who have anxiety disorders, they have depression, they're drinking heavily, and their medications aren't really doing as much as we would like. So alcohol can exacerbate existing psychiatric conditions. Nicotine, not so much. So yeah, I would say, again, another area where cannabis and alcohol are pretty similar.
I'd like to thank Dr. Hill for coming.
Thanks.
I think it's, getting to be 8:30, and he's got a long ride home. I'm sure he might answer a question or two just on his way out, but I want to give people a chance to leave. Can we give Dr. Hill another round of applause?